So at our center, the vein to vein, or even more importantly, the brain to vein time, as we call it, the idea of the first day you decide you're going to give CAR T-cell therapy to the time the patient gets it, can be months. And that's not just due to the manufacturing time of autologous CAR T-cells. It's due to the complexity of scheduling patient collection, apheresis, obtaining insurance approval, making sure there's bed availability, all the factors that are necessary for this complex therapy to work. Off-the-shelf cell therapies could definitely bring a big change to that. Now, we do have to keep in mind that there is a very effective class of off-the-shelf immunotherapies that already exists, bispecifics. And so you will see at many centers different practice patterns based off the perceived relative efficacy of CAR T-cells, particularly cilta-cel, versus the ease of administration of an immediately available off-the-shelf bispecific. The hope of these off-the-shelf cell therapies is that you could get both. And of course, that hasn't been demonstrated yet. If it were to be demonstrated, it would definitely be a game changer for the field.